Today we're going to be talking about the truth behind liposuction. So some of the most common misconceptions about liposuction is, I can lose a lot of weight. Well, liposuction is a removal of fat technique, but it works the best for patients that have isolated pockets of fat. So if you're looking for weight reduction, significant weight reduction, maybe you should be looking at maybe the injections, Ozempic, things like that, further diet and exercise, or maybe even some of these gastric bypass procedures. So liposuction per se is not a great weight reduction surgery. It's more of a shape surgery. We also get a misconception that liposuction is great for removal of cellulite. Well, not really. Cellulite basically is scarring of the skin, indentations of the skin due to the contraction of these scar bands. Liposuction is removal of fat. It's not really release of the scars. So liposuction is not really the best tool for cellulite removal. One of the more common misconceptions about liposuction is it corrects sagging skin. Well, again, remember, liposuction is removal of fat. It has nothing to do with skin. We get some slight contraction of the skin as the fat recoils, but again, liposuction is all about removing fat, not skin. Sometimes the sagging skin gets worse when you do liposuction because we're removing that substrate, we're removing that volume underneath the skin. Liposuction can help aid weight loss, but again, if you're looking for weight loss, pure weight loss, it's much better to diet, exercise, some of these medical grade shots, or weight reduction surgery. So liposuction can help. Again, the best liposuction candidates are patients that have isolated pockets of fat, little pockets about the size of a softball, etc. So liposuction is great. You know, when we first started out, like in the early 1970s, we saw a pocket of fat, we'd put a surgical straw in it and suck out the fat. Problem with that, it was extremely painful, it was very bloody, and there was sort of uncontrolled access to the fat. But the concept was there. So over the years, we've perfected it, and now we inject tumescent solution where we put fluid in to minimize the pain, minimize the bleeding, and now we're just removing isolated pockets of fat. So the recovery time is different for every patient. Maybe you're young and healthy and we're only taking out like a liter. Maybe you're a little bit older with some comorbidities, high blood pressure, diabetes, things like that. Your recovery is going to be a little bit longer, and maybe we're doing extensive lipo, 360 lipo all over the body, and we're taking out maybe 5 liters or something like that. Your recovery is going to be a little bit longer. But on average, recovery from a liposuction procedure should be about 1, maybe 2, maybe 3 weeks. Very important that you follow your plastic surgeon's suggestions. In my practice, I suggest a lot of fluid. What your body does during the swelling, your body gets swollen because it takes fluid out of your circulation and puts it into the soft tissue. So even though you look very swollen, you're actually dehydrated. So it's very, very important that you drink a lot of fluid, a little bit of ambulation to get the circulation going, and then very, very important that you wear those compression garments. Those compression garments minimize the swelling, maximize the healing, helps things to contour. Lymphatic massage is also very important to get the swelling out of the tissues. Patient safety is probably the most important thing. So one of the things we do to maximize safety is in the pre-op, we order a lot of labs. We're going to check your blood, EKG, chest x-ray, urine, everything like that to make sure you're healthy going into the surgery. We prepare you a lot. We spend a lot of time with you. I spend a lot of time with you. My office staff spends a lot of time with you preparing you for the surgery so you know what's involved during the surgery and after the surgery. So preparation is very, very important. Now during the procedure, there are a couple of things we do. One, we give you antibiotics before the surgery. Number 2, we usually give you a blood thinner to minimize the blood clots during and after the surgery. Number 3, we use a board-certified MD doctor anesthesiologist to do your anesthesia, so you're completely controlled by a doctor anesthesiologist during the procedure. And then another thing we do is we have these leg squeezers on you all throughout the procedure to minimize any blood clots. So those are very important concepts and things we do to minimize any complications during the surgery. For a BBL is a Brazilian butt lift where we take fat from one area and we transplant it to the buttock to get buttock augmentation. So when we transfer fat, especially to the buttock, we put it in the buttock and it lifts the buttock, and it also augments the buttock by making it bigger. So the only way to do a BBL is by doing liposuction. It's sort of part A. You can't get a BBL without liposuction. So to get a BBL, you have to do liposuction. So BBLs by default, because they have to have liposuction to get to the result, has increased the number of cases that involve liposuction. But even before BBLs were very, very popular, liposuction is the most common procedure on the planet. Very important after liposuction, if you want to keep your results, don't gain weight. So the patients that get the best results have their liposuction, and then usually after about 2 or 3 or maybe even 4 weeks, then start to eat better or even more healthy and exercise. Those lead to much more consistent, long-lasting results than patients who just have the liposuction. They go, oh, I'm glad I got rid of that weight. Now I have license to eat. So very important that you continue to eat right after the surgery and exercise. So if you gain weight after a liposuction procedure, it's not that you're going to gain all the weight on the area that was liposuction. It doesn't work that way. So if you're going to gain weight, but please don't, if you gain weight after a liposuction procedure, fat is equally sprinkled out throughout your whole body. So if you have liposuction on your tummy and your love handles and you gain, say, 10, 15 pounds, you're going to get some fat in the tummy, some fat in the love handles, but you're also going to get fat distributed throughout the other areas, your thighs, your back, your arms, your neck, those kinds of areas. So it's going to be equally distributed throughout your entire body. It doesn't have a propensity or a likelihood to go back to one area that it had liposuction. So when we do liposuction, I suck out the fat. The fat cell is actually removed in a bucket and we throw it away, medical waste. It's physically gone. It's eliminated from your body. We don't remove 100% of the fat cells in that area. Then it would just be skin on top of muscle. Sometimes we want that, but it's very rare. We usually do that when we're doing like high-def sculpting of the arms and the six-pack, but usually we leave a little bit of the fat cells behind. So with cool sculpting, we use a device that freezes the fat and then the fat dies. Morpheus 8 is sort of a different procedure. It traumatizes the skin with needles, then it shocks the skin to contract. But those aren't nearly as effective as, in my opinion, as liposuction. Liposuction physically removes the fat cell, throws it away permanently to give you those great results that we see with liposuction. So with liposuction, it really depends on the health of the patient. Age is important, but it's not sort of a restricting criteria. I don't do liposuction on patients younger than 18. For the maximum, I really don't have a maximum. We've done safe procedures in patients 76 years old, but they were healthy. They didn't have any other medical problems. They dieted, they exercised, so they were a good candidate for surgery. So in terms of age restrictions, no, we don't really have age restrictions for liposuction. It's more of a health restriction. And the Vaser is a very, very strong instrument that uses ultrasound or sound waves to break up the fat and heat the skin. Now when you break up the fat, it literally turns the fat cells from butter into margarine. It sort of liquefies them and makes the liposuction process a lot easier. The fat, and you can see some of the videos where the fat just drips out of the cannula site because it's been melted. So the Vaser decreases swelling, it gets you better results and decreases the bruising and leads to faster healing time. Those have all been clinically proven in our plastic surgery data. But for us, we use it to get you that six-pack on the abdomen. We use the Vaser also on the arms to sculpt out the deltoids, biceps, and triceps. And we use it in the neck to chisel out the neckline. And since the Vaser is so good with scar tissue, we use it a lot of the time on revision liposuction. So say somebody's had liposuction with another plastic surgeon, they're not pleased with the results, and they have some areas of lumps and bumps and scar tissue, then we would go in with the Vaser to help melt that scar tissue. I think it's very important to understand if you're looking for a weight loss solution, you should think about weight loss surgery, weight loss treatments, diet, exercise, medical injections, maybe even surgery. But if you have isolated pockets of fat, then that may be the best treatment with liposuction. So thanks for watching Plastic Surgery 90210. Please tune in next time.